Radiaguard lotion is used on the skin to stop itching and pain from certain skin conditions such as scrapes, minor burns, eczema, and insect bites. It is also used to treat minor discomfort and itching caused by hemorrhoids and certain other problems of the genital/anal area, such as anal fissures and itching around the vagina/rectum. Additionally, some forms of this medication are used to decrease discomfort or pain during certain medical procedures/exams, like sigmoidoscopy and cystoscopy. The active ingredient, lidocaine, is a local anesthetic that works by causing temporary numbness/loss of feeling in the skin and mucous membranes. When using Radiaguard lotion, it's important to follow the directions on the product package. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, use it as directed. Before applying the lotion, make sure to clean and dry the affected area as directed. Apply a thin layer of the lotion to the affected area of skin, usually 2 to 3 times a day or as directed. If you are using the spray, shake the canister well before using. While holding the canister 3 to 5 inches from the affected area, spray until wet. If the affected area is on the face, spray the medication onto your hand and apply to the face. Do not spray near your eyes, nose, or mouth. If you are using the foam, shake the canister well before using. Spray the foam onto your hand and apply to the affected area. Do not use on large areas of the body, cover the area with waterproof bandages or plastic, or apply heat unless directed to do so by your doctor. These may increase the risk of serious side effects. Wash hands immediately after use unless you are treating an area on the hands. Avoid getting the product in eyes, nose, or ears. If the medication gets in these areas, rinse the area immediately with clean water. The dosage is based on your medical condition and response to treatment. Do not use more of this product, use it more often, or keep using it longer than directed. If there is an infection or sore in the area to be treated, do not use this medication without consulting your doctor first. If your condition lasts or gets worse, or if you think you may have a serious medical problem, get medical help right away. When using Radiaguard lotion, you may experience temporary redness, stinging, and a little swelling at the application site. If these effects persist or worsen, it's important to notify your doctor immediately. If your doctor has prescribed this medication for you, it's because they have determined that the benefits outweigh the potential risks of side effects. Many people who use this lotion do not experience serious side effects. However, seek medical help right away if you experience any severe side effects such as slow or shallow breathing, seizures, pale or bluish skin, unusual tiredness, shortness of breath, or fast/slow/irregular heartbeat. While it is rare, a very serious allergic reaction to this drug can occur. Get medical help immediately if you notice symptoms such as a new or worsening rash, new or worsening itching or swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not an exhaustive list of possible side effects, so if you experience any other effects not mentioned, reach out to your doctor or pharmacist. If you're in the US, you can call your doctor for medical advice about side effects, or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada at 1-866-234-2345. Before using Radiaguard lotion, it's important to inform your doctor or pharmacist if you have any allergies to lidocaine or other similar anesthetics. It's also important to discuss your medical history, especially if you have broken skin, heart disease, liver disease, or a certain blood disorder. If you are scheduled for an MRI test, make sure to let the testing personnel know that you are using this product, as some brands may contain metals that can cause burns during the MRI. Before undergoing surgery, be sure to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's important to note that children may be more sensitive to the side effects of this drug, and if you are pregnant, it should only be used when clearly needed. It's best to discuss the risks and benefits with your doctor. Additionally, this medication can pass into breast milk, but is unlikely to harm a nursing infant. It's still important to consult your doctor before breastfeeding while using Radiaguard lotion. When using Radiaguard lotion, it is important to be aware of possible drug interactions. These interactions could affect how your medications work or increase your risk for serious side effects. It's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure that you are using Radiaguard Lotion safely and effectively. If Radiaguard Lotion is inhaled or swallowed, it can be harmful. In case of an overdose with serious symptoms like passing out or trouble breathing, it is important to seek immediate medical attention by calling 911 or contacting a poison control center. Symptoms of an overdose may include drowsiness, irregular heartbeat, and seizures. Make sure to schedule and attend all your regular medical checkups and laboratory appointments. This is important to monitor your progress and to make sure that the medication is working effectively for you. If you forget to use Radiaguard Lotion on your regular schedule, use it as soon as you remember. If it's close to the time of your next dose, just skip the missed dose and continue with your regular schedule. Do not use a double dose to make up for the missed one. When using Radiaguard Lotion, it is important to store it at room temperature and avoid freezing. Make sure to keep it out of reach of children and pets. Additionally, do not store the gel, foam, or spray canisters near high heat or open flame. Since the foam or spray canisters are pressurized, avoid puncturing or burning the container. When you no longer need the product or it has expired, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.